The founder of Center for Attitudinal Change, Cfac, Mr. Ralph Ayua, has called for the continuous support for internally displaced persons residing in Pegi town of Kuje local government. Kuje Area Council. Mr. Ayua, alongside his team, who were on a working visit to the camp, stated that with the present economic challenges in the country, the internally displaced persons are vulnerable to vices in the society based on their previous background. Our correspondent Isa Nuhu was at Pegi community for that event and now reports.
Mr. Ralph Ayua said beyond the provision of farmlands, the internally displaced persons are finding it difficult to live. He said all he and his team can do is to provide support to the vulnerable community.
But we're here because of the internal displaced people that were accommodated in this community. We started a project about a year ago on mental health intervention for those who are internally displaced in Nigeria. And we have been to places, and this is one of the places that we have chosen at the end of the year to intervene, to help them heal from their traumas, to help them to be able to survive. We brought them food. We have come here with medical help, medical intervention.
The chief of Pegi community, Irmia Nisana, said since 2014, they've been living peacefully with the internally displaced persons, and the support provided by the non-governmental organization has been life-saving for most of the persons displaced. Mr. Wakil Chiroma, the head of IDP camp, on behalf of the IDPs, appreciated the role of Cfac and appealed to the government to provide land for them to settle.
So I receive them to my community. We stay here together with them. So I give them houses to stay. They are all farmers. Also I try to talk to my people to give them a small portion to do a farm.
Representative of the NDLEA and National Human Rights Commission, Mr. Nduka Augustine and Mrs. Oluchi Adeze also spoke on the issues of drug and social abuses that may arise in the community.
NDLEA has been invited to come and sensitize the camp to understand that the psychological trauma that they've been exposed and they are facing, they may not solve it by taking to drugs, taking to alcohol, taking to other substances to cushion the effects of this trauma that they are facing.
The highlight of the working visit were the activities carried out in the camp, such as medical checkup, drug abuse sensitization, mental health and human rights counseling, which were crucial to the health and well-being of the displaced persons in the Pegi community of Kuje local council area. Isanu, ASO TV News.